Good afternoon, everybody. My name is Tim Handley. I'm General Manager of the National Safeguarding Office. We'll start in 1 or 2 moments. There are still people joining our online discussion on how do we promote the message that adult safeguarding is everyone's business. So bear with us and we'll start in 1 moment. Thank you. Okay, we're going to make a start. Good afternoon, everybody, and you're all very welcome. My name is Tim Handley. I'm General Manager with the HSE's National Safeguarding Office. Today is November the 19th, a really important day. It's Ireland's first Adult Safeguarding Day. The day is being led and coordinated by Safeguarding Ireland, which is an intersectoral organisation of organisations, services, professional bodies that promote the message of safeguarding and seek and reform and change to better the lives of people who may be at risk of abuse. I'm delighted on behalf of the HSE and the National Safeguarding Office to have a very interesting panel for you today. We're going to be discussing how do we promote the message that adult safeguarding is everyone's business. And we hope we'll do justice to the theme of today, which is about promoting human rights, strengthening empowerment, and building services that people can live good quality lives. So I'm going to introduce my panel. Just a couple of things to say to you, kind of housekeeping rules. Today will be recorded. So the video from today or the link from today will be issued out by our office, and my colleagues in Inclusion Ireland and Sage will also be hosting the link for the video. There is a chat function on the right hand side, and our moderator Bridget, if you've any questions you'd like to put to the panel or queries or comments, we'd be delighted to have that. We've had some questions and comments in advance. So on the right hand side there's a chat function there. We'll be taking about an hour. We're going to watch a video first of all, and then we're going to have a panel discussion with my speakers. So let me introduce our 3 speakers. Firstly, I've got Dervla McDonough, and Dervla has over 20 years experience supporting people with intellectual disabilities. She's passionate about inclusion, belonging and valuing people. She commenced her career as a speech and language therapist. She graduated from Trinity in 1999. Although she has not practiced in some time, she brings with her an appreciation of the power of communication and the right to accessible information for people with disabilities. Having taken on the role of CEO at Inclusion Ireland just recently in September 21, she's fully committed to working in partnership with people toward a more inclusive Ireland where people can have their fundamental rights met as equal and valued citizens. She believes that societal change is necessary, moving away from our outdated models of service provision towards supporting people to have a good life. She believes that everyone has a voice, but first we need to understand how to listen. So you're very welcome, Dervla. Next, I have Sarah Lennon, and Sarah is Executive Director of Sage Advocacy, which is a national advocacy organisation working to promote, protect and defend the rights and dignity of vulnerable adults, older people and healthcare patients. Sarah has a Bachelor of Civil Law degree, a Master's in Equality Studies, and recently completed a professional diploma in Creativity, Leadership and Innovation. Sarah has over 15 years experience working with advocacy organisations, including working for Inclusion Ireland, the National Association for Intellectual Disability and the Irish Council for International Students, ICOS. Throughout her work, Sarah has direct experience of working with older people, people with disabilities and their families, and has supported people in relation to capacity and consent, wards of court issues, deinstitutionalisation and safeguarding issues. Our third panelist, and hopefully I've got my piece of paper here, is one of our colleagues in the safeguarding protection teams, That's Geraldine Sutton. Geraldine is a qualified social worker with over 20 years experience in the child protection and the adult safeguarding fields. She is currently principal social worker responsible for safeguarding and protection in the Southeast, which is Kilkenny, let me get this right because I always get it wrong, Kilkenny, Carlow, South Tipperary, Waterford and Wexford, and she's also a member of Safeguarding Ireland Advisory Group. So Geraldine, Deborah and Sarah, you're all very welcome. Can I thank my team and background there, I know Donal and Bridget and Colleen and Carol have also been helping to set today up, because I always forget to thank people at the end, so I've been making it a habit to start and thank people at the start. So today is one of a number of activities. I was on a webinar this morning with our Association of Social Workers, who made a very compelling case for the need for primary safeguarding legislation. I know organisations, services and professional bodies right throughout today, and not just this week, not just today, but right throughout the week, have been highlighting the need for adult safeguarding. And I'm told we're trending at 5. Not quite sure what that means, but I believe it's something really good that you get noticed and people take attention. I'm first of all, before I come to the panel and we have our discussion, we're just going to give the opportunity to view one of the videos that Safeguarding Ireland, really good, informative, clear videos. And I think that's really important, that information is shared well, and something that Dervla highlighted there in our bio. So I'm going to ask Donal, hopefully the video will work. We had a few little hiccups earlier on, and it's these are all available on www.safeguardingday.ie or on Safeguarding Ireland's website. And this is about 4 minutes long, and it explains what is safeguarding. And I hope you'll find it informative. Okay, Donal, hopefully you can roll it there.
Every adult, regardless of their position or their creed or religion or gender, is entitled to live a life free of abuse and exploitation and neglect. So safeguarding is about putting in measures to protect people from harm and from abuse.
Safeguarding means empowering and protecting people's rights and their general well-being, and empowering a person to protect themselves against abuse.
Anyone over 18 at any stage in their life could be vulnerable to abuse for reason of disability, old age, illness, a diagnosis, a traumatic event in their life. And they will need support around that time, but equally that leaves them vulnerable to people maybe taking advantage, either intentionally or unintentionally. And so at that stage, then it moves into the area of abuse.
If somebody is in immediate danger, they should contact 999 or 112 in an emergency situation. If somebody is not in immediate danger but is suspected of suffering harm, you should contact the local Garda station. In other cases, people should talk to a trusted friend or relative. Could talk to the GP, public health nurse or other HSE worker. There are also safeguarding teams in each community area in the HSE, and these teams are made up of social workers. And these are very discreet and very experienced in dealing with suspected cases of abuse. There are also other organisations like Women's Aid and Men's Aid and several other organisations that people can contact for advice and guidance in relation to abuse. One of the biggest things that we can do is to make people more aware of the issue of safeguarding and the issue of abuse. Very often people engage in abusive behaviour not realising that their behaviour is abusive. And it has been the experience of many on safeguarding teams that when the behaviour is pointed out to the individual, the abuse stops.
We need public awareness about safeguarding. We need to plan ahead in relation to decisions, important decisions that need to be made in the future, when we may not be in a position to make those decisions personally, such as around healthcare decisions, social care decisions, finances, or general affairs. And we also need safeguarding legislation and social care legislation.
People have rights to choices and autonomy, regardless of their abilities or disabilities. And those rights and choices have to be respected, regardless of the situation the person is in.
Thank you very much, Donal. I know the slides, because of what broadband, they might have been a bit slow on some of the transitions there. I think the video itself is excellent. As I said, it's available, and as are a number of videos on the Safeguarding Ireland website or www.safeguardingday.ie. So, and I'm sure you'll promote that and encourage others to view that. And the videos are an excellent resource. I'm going to start off by asking each of the panel members what do they think safeguarding mean? What does it mean to them? What does adult safeguarding? Then we'll come on to look at maybe some of the issues at a societal level, some of the issues at policy level, right down then to some of the issues for safeguarding teams and how people contact them and how we promote the message of adult safeguarding and empower people to take I suppose steps themselves. So maybe I'll start with you, Derval, Inclusion Ireland. What does safeguarding mean to you?
Yeah, thanks, Tim. I suppose what it means to me and to our team at Inclusion Ireland, it's really down to people's human rights. And I think sometimes the term safeguarding can be confusing for people, or people might not fully understand what it means. But really it is about our fundamental human rights around dignity, around choice, having control over our lives, and being free from abuse. So, like with everything that we're about at Inclusion Ireland, it is about people's fundamental human rights.
Okay, thanks very much, Derval. Sarah, I'll ask you the same question from your standpoint. What do you see as safeguarding?
Absolutely, and like Derval said, it's fundamentally about protecting rights. And I think what we all need to bear in mind is that at some point in our lives, either we or someone we need, someone we know in our families or friends, we're gonna need safeguarding at some point in our lives. So it's all of our responsibilities, and we don't know in our lives we or a family member will be in a vulnerable position, or be left vulnerable by the circumstances we're in. So it is about fundamentally, as Derval said, protecting adults' rights, particularly to live safely, to live free from abuse, from neglect. But importantly as well, safeguarding is not always about safety. It's also about protecting people's rights to make decisions for themselves and to take risks in their lives as well. So it's complex, but it's something that will touch each of our lives as we go through it.
Thanks very much, Sarah. Geraldine, would you like to add anything from your perspective or the safeguarding team perspective, or what does safeguarding mean?
Yeah, I suppose it's just great to hear previous two speakers there, because we really are all on the same page. Our understanding of what safeguarding is across, HSE funded services, charities, advocacy services. It really is so important to look at how we safeguard when something goes wrong and how we try to do preventative safeguarding. And I suppose I often kind of see it nearly as a spectrum in, when somebody's referred to us, unfortunately abuse, could have happened, or there's a suspicion, or there's some indicators. But really, the term safeguarding starts right at prevention. So whether that's putting in supports now for your older age, making some changes to your home environment so that, if you're discharged from hospital, you've got a downstairs bathroom. It's everything along that spectrum of, putting protections in place for your money should the day come when you can't manage it. So we can safeguard ourselves now for our future selves. I suppose that's what I think. So it's really good to hear that a day like this, and to see the messages getting out there, and it's so important.
Okay, thanks very much, Geraldine. Really strong perspectives there on the human rights-based informed approach and plan ahead and prevention. Sarah, if I come to you first, I mean, the theme of this is how do we promote the message adult safeguarding is everyone's business. And I suppose it's easy to say that, but from a policy perspective and a kind of reform of sort of legislation and things like that, how do we make that happen? How do we, very often we have events like this, and sometimes we talk to the converted, or we have our, we speak to ourselves, but to really reach out to make change, and that safeguarding is seen as everyone's business. How can we do that at societal and a policy level? What do you think needs to happen or change to make that a reality?
I think it's a very important point. We do need changes in law. We do need changes in policy. in Ireland. We know for a long time that there's been mooted adult safeguarding legislation. There's been bills. It's on the programme again for legislation this year, but only in the context of health services, which is a narrow look at adult safeguarding. We know that as part of Ireland signing up to the UN Convention on the Rights of People with Disabilities, we've committed to protection of liberty safeguards. And there are two key areas: adult safeguarding more generally, not just within health, and protection of liberty. But I think, as we've seen, Tim, with the Assisted Decision Making Capacity Act in 2015, another core piece of legislation which we hope will be fully up and running in June or July of next year, that needed to go hand in hand with a culture shift and a culture change and a paradigm shift and all of that language, but definitely a change in culture around respecting adults as decision makers, as rights holders. So the two things do need to go hand in hand. It's been painfully slow, I think it's fair to say, a lot of legislation and policy change in this area. It's complex. A lot of the time things are complex and not easy to reform and change. But I think if we get the legislation and policy right, coupled with good culture and training, of course, as well, I think that we'll see real improvements over the coming years.
That we have to inform people's attitudes and their cultural beliefs around people's rights, as well as getting the policymakers and the legislators to bring in as you say, the full commencement of ADM. We've got the protection of liberty safeguards. Hopefully we see primary safeguard legislation. So it's a lot to be done, but you're still hopeful that the roadmap is there, hopefully. Thanks very much for that, Sarah. Derval, if I could come to you again, this message about making safeguards everyone's business. We hear a lot about empowering people and empowering service users, empowering adults themselves. What do you think will be important to make a difference there? And you said that in your bio there around communication and accessibility of language and materials. Talk to me a little bit about what you mean by that.
Thanks, Tim. Yeah, I suppose the power of information and of providing information to people in ways that are accessible cannot be underestimated. And too often the very people that we're trying to reach are left out of the conversation because the language that we're using, the terminology that we're using, how we're describing things is far too complex. And I think we need to bring things back to basics. And I think some of those videos on safeguarding.org have done that very well and very effectively. And there's probably more work that we need to do in that space, because really information is power. So if we're talking about empowering people, people need to be able to understand the information about how to protect themselves, stand up for themselves. And the only way to do that is to provide that information in ways that are accessible. So whether that's, that's not easy at times, and there has to be real solid intention behind it. And it's not enough to just say, oh, look, we've done something in plain English, or, oh, look, we have a video, or, it needs to be a whole spectrum of information that we provide to people, and not just provide it once, support people over time to understand it. So I think there really needs to be intention around that to fully empower people. So information is just a key part of that.
And Sarah touched there about commencement of assisted decision making. It's not just this is a legal requirement. This is something we very much have to do. And I was very struck the recent book that came out on personal and professional reflections on the commencement of assisted decision making. There was one piece I was reading by Adam Harris about his experience or lived experiences of somebody with autism. He said virtually all the people who made decisions about him right throughout his schooling and his life had no lived experience of autism. It really struck me that, and as a HSE manager in my time, it just that the simplicity of what he said that was just so powerful. How do we translate that? How do we get that engagement right? How do we understand better the lived experience, Derval, so that in the way we, and I know it's very complex because there's a variety of people with different backgrounds, with different experiences, with different cognitive issues. But have you any kind of messages for policymakers or people who are involved in devising materials or platforms?
Yeah.
What's the best approach there?
Well, I suppose, Tim, it's, I know it's been said a million times before around nothing about us without us, but I think we have to take that very seriously. And any policy decision that's been made, any change, needs to reflect and include the voice of people who are being affected by that policy. And I suppose we have a long road to go in Ireland in terms of supporting people to advocate for themselves. And there is a lot of positive work happening in that space. And I know Sarah and I and both of our organisations are very involved in that space in the background in terms of supporting people to build their own capacity to stand up for themselves and be involved in decisions that affect them. And that just involves us. Again, it's back to that being intentional about it. Whenever we're having a conversation, a discussion, whenever we're talking about a policy, that we include people with the lived experience and that we really support people to have their say in a meaningful way.
Okay, thanks very much, Dervla. Geraldine, I'll come to you. One of the things has been highlighted many years in the annual office report that we undertake is the underreporting of abuse in Ireland, and by international standards and prevalence studies, both elder abuse, particularly elder abuse, but all forms of abuse has been underreported. What do you think are some of the barriers or challenges on Adult Safeguarding Day, that why more people themselves or people who see or observe or become aware of abuse aren't coming? We saw this in the polls that Safeguarding Ireland undertook, that there are some challenges and barriers around people coming forward to the likes of the health service executive or to seek out assistance. What do you see those are, Geraldine?
Yeah, so that's really interesting point. And I suppose I started as an elder abuse social worker, in 2007. And, one of the views was that, 3 to 5% of the population at any one time, the adult population, is experiencing abuse, whereas really our reporting it can be anything as low as, 1.5 to 2%, right up to about 3%. So there is definitely underreporting. Some of the reasons I would see, I suppose, is, straight off, you're talking about people in their home, you're talking about adults who can make their own decisions. There isn't any mandatory reporting as such. I mean, there's a duty of care on many people, but there isn't a mandatory reporting, and I was on an earlier webinar today, and, people don't know about us as much as they should. And again, these types of days give us a chance to promote the services that are there. And it's not just the safeguarding team that is there to take referrals and support people. There are lots of services within HSE funded service and charity that are there to support people and support them through a difficult time. But definitely what I've found when I've been out at the door with people is people feel embarrassed. They feel they don't want to tell their story to somebody who's just called to their door. It takes some time to build up trust, and equally it takes some time for people to even understand that they've been abused. So often people will be experiencing abuse, such as, for example, maybe financial abuse, and will not realize that that's what it is. Will often believe that the person they're living with has an entitlement to behave in a certain way towards them, whether that's around their finances, about making their decisions. So because of that, people don't speak out because they don't know. And when they start to realize something is wrong, they don't want to speak about it for the consequences, as I mentioned, maybe an embarrassment around it. And sometimes the consequences are unfortunate. So if somebody is living with the care that they're fully dependent on, and an allegation is made or there's a concern raised, their absolute fear is, I can't live with this person anymore. And as you can imagine, it'd be very difficult for some of us here today, and I'm sure, to say, well, why would they stay in an abuse situation? Well, they stay in an abusive situation because that's their family, that's the person they love. They don't want to live in an alternative environment, like, say, nursing home or other place, for example. So they will put up with the abuse. So they want the abuse to stop, but they don't want the relationship to stop. And that's a huge risk if you start to speak out about what you're experiencing. That actually could be the outcome.
Thanks, Geraldine. That's really informative around, I suppose, culture and family and the dynamics around how people can speak out, the consequences for them, the concept of entitlement, that people may feel they have a right to someone's finances or money. Dervla or Sarah, would you like to stand about that? Because I know whilst primary legislation is really important in the change and reform the law, I think it was yourself, Sarah, touched on it. that Irish society also, there needs to be changes in our values and our attitudes around people. I see you nodding your head there, Deborah. Do you want to say something about that element of it, how our attitudes as a society needs to change as much as the law needs to change?
Yeah, and I think it's what Sarah touched on earlier about moving away from seeing people, and even though we use the term vulnerable quite a bit, you know, trying to move away from that language and towards people as being rights holders, citizens, people who can and should have their rights met. And I suppose what we see as being, you know, very normal things for the general population, getting to choose who you live with, where you live, having choice and control over your day-to-day life, is not really the case for so many people who have an intellectual disability or who might be vulnerable to abuse. So we have to look at that, and our attitudes and beliefs about people with disabilities have to change. We have to see people as valued citizens, and in that we have to hold the same standards for those individuals. So imagine what it would be like to be told in the morning that you have to live in this house with these 6, 8, 10 people who you may or may not like or get along with. You have to live there forever. And even if those people in your life you don't like, and they are, you know, you're at risk of abuse from them, you are going to have to continue to live there. That is what's happening across the country today. So we have to take that really seriously, and it's a whole shift in our mindset about how we support people. And I mean, some of the practical ways that that can be done, and I know there's work being done on this in the background, is really looking at changing that model towards people being budget holders and right holders, so that they have their own personalized budget. They can make choices and decisions about where they live and who they live with. And it really shifts that paradigm then. And that's for people who only might require an hour or two of support a week from somebody to manage their finances, right up to people who might need around the clock support and have pretty high support needs. But our whole attitude has to change around that.
Thanks, Sarah. No, really important point there about not only the shift in mindset, but also how we organize services, resources around really meaningful, person-centered, that with a human rights-based approach. And you know, there's still a very long way to go. I have a couple of questions coming in. I think I might ask Sarah to touch on this one. Is a question here about, could you talk a bit about institutional abuse? I know you work a lot with residential and nursing homes, and I don't want to single them out. Institutional abuse can happen anywhere, it can be within any type of organizations. But what does it look like? The question here about what does it look like and how can it happen? You know, we've heard a lot in the media and reports that, but talk to me a little bit about how it can happen, and how it manifests itself, Sarah. Do you want to touch on that?
Yeah, absolutely. And I think, look, institutional abuse can happen really within any facility. It's not necessarily within a particular type of environment, but it's really where, I suppose, there's an imbalance of power, or there's a lack of recognition of people's rights. And I think what Sage Advocacy would have noticed over the pandemic was nursing homes, for example, became much more isolated places than they would have been previously. People didn't get to go into their community, and also didn't have visitors in to see them as well. And so, look, we know when it comes to safeguarding, you know, a lot of the time family can be the ones who are maybe putting the adult at risk of abuse. But certainly within, I suppose, our experience throughout the pandemic was that the removal of visitors, the removal of that contact with the outside world, led not only to institutionalization, but other situations where people weren't having access to their rights. You know, we established a kind of a family forum throughout the pandemic, where we thought, you know, we might be able to provide some information to family. They're not our typical constituency base, but to provide information to family around, you know, things like visiting restrictions and that type of thing. And we were inundated with people just seeking information. And when they had gone back in to see their family member after a long period of separation, that people were often shocked by how their family member appeared, you know, whether they still had the life within them, that type of thing. So I think big challenges for us ahead in terms of reconnecting a lot of our institutions in Ireland, particularly nursing home environments that have been so cut off, back with their communities, and making sure that people have the support that they need.
Sarah, we're getting that balance better around the rights of people with autonomy and their relationship with their families and visitation. and the whole emphasis on infection control during the pandemic. Has it got better from your perspective?
It's definitely been an ebb and flow. There's been obviously times where, particularly at the outset of the pandemic, we know the devastating impact that the virus had on any congregated living or institutional environment, people living that closely together. You know, it was always going to have a very severe impact. But I think we'll see in the years to come, maybe the impact that some of the public health decisions to shut off nursing homes from family members, and of course not just nursing homes, you know, residential facilities for disabled people as well, in terms of mental health and overall life expectancy as well.
Thanks very much, and it's really important we acknowledge the impact that COVID had on people, and also in the community, the impact that cocooning had on older people, particularly who live in the community. I have a question here I think I'll put to Geraldine, and it's around what are designated officers, and a number of people logging on today are designated officers. Some people are coming new to this webinar, wouldn't know they play a hugely vital role across care services, residential services. Geraldine, do you want to say a little bit about what the designated officer does and why they're so important in this, so the process around responding to abuse concerns? Do you want to tell us a little bit I've got a question in about that.
Yeah, absolutely. It's a really good question. And I think definitely this has been quite a new way of working for us in the HSE in general. So my team, as a team of safeguard and social workers here in the Southeast, we would both be designated officers in relation to older people in the community mostly. And then, but we would also have an oversight role on the work of designated officers in residential care, be that or, you know, supported living units, so be that disability or older persons. And in each unit, there is a designated officer that works under the safeguarding policy, which is the same policy, 2014 policy that we work under in the HSE. And the designated officer really is tasked with carrying out a preliminary screening of abuse. So what will happen is somebody will undergo the safeguarding training. They will then undergo designated officer training. They will be given the skills they need to, you know, respond to allegations of abuse. So more than just sending in a referral form to a particular service, they will actually be screening the concern. They'll be looking at what has happened, what actions they need to take, and they'll be really coming up with an outcome. So it's quite a responsible piece of work, and it's really, really important. And I suppose when I started this job first, I trying to get my head around how the policy structured the services, and over time you can really see the benefit of designated officers working in services who know the residents so well, who know the services so well, who know the environment, who know their own deficits, who know their own strengths, and trying to protect somebody from abuse that unfortunately can happen, and put in a plan to protect them. I just feel it's a very, very good way of working. It's that part of, you know, and it's the Sláinte care view, and it's across all society. It's, you know, giving somebody the right service at the right time, the right place. So having somebody trained with a knowledge of safeguarding and abuse and how it happened, you know, targeting their service, safeguard proofing the service, training the staff, writing up the preliminary screenings, and getting the support from the safeguarding team, which is what we do. So what we will do then is when a designated officer does the preliminary screening and comes up with an outcome, and those outcomes can be no grounds for abuse, additional information, or reasonable grounds, they will send that preliminary screening plus the outcome into the safeguarding team, and an allocated social worker will view that preliminary screening, go through the outcomes, and make some comments. You know, we mostly agree with it. If we don't agree, we go back with our feedback. I'd nearly describe it as being the cross-check on an airplane. That's how I like to describe it, where they're doing the work and, you know, they're bringing it into us. We're having a check over it. Usually it's absolutely fine, and we'll make some suggestions. And also it's another way of escalating the issues as well. So it really puts that onus back on the service, who know the person well, know, you know, are part of their everyday lives, and supporting them and protecting them in the place where they live. So it is definitely a very good way of working, but
Okay.
not without its challenges
Sure.
as well, because we're so conscious that a lot of the designated officers are not social workers, but we are finding the quality of the preliminary screenings that we get in are absolutely top notch from all, you know, we would get preliminary screenings from psychologists, from social care workers, from nurses, you know, senior administrators in their services, and they really get the understanding, which is what has gone on here, recognise, respond and report abuse. And they're the three really key words. Yeah.
Yeah, thanks for that. That's really informative. Just coming back to you were describing some of the work of your own team, and for people logging on today that might know a huge amount about what social workers do and safeguarding teams do. Just tell us if you got a report of an elder abuse. You talked earlier, say financial abuse or emotional abuse from an older person. How you might get it in from a public health nurse or a member of the public or another family member. Just like to tell the people just how you as a team would respond to that. Just because there are people logging on today that may not have the inside track or the knowledge of what safeguarding does.
Yeah. Yeah, so what's really important, I suppose, it's a very much a social work role. So very similar, you have child protection social workers, we would be adult protection social workers. But again, we're working in a completely different sphere. We're working with adults who have, you know, whether you're 18 or you're 80 plus, you've got the same rights. You've right to make decisions, and you have right to self-determination, which really means that you have a right to make decisions that potentially can put you at risk as well. So you're in a different sphere in that you really are trying to empower somebody, put plans in place, work with that person to put plans in place to protect themselves. So I suppose your question is in terms of when a referral comes in. I suppose the first thing to say is that social workers are trained in risk assessment. We're also trained on, you know, record keeping, report writing, listening skills. So there's a huge amount of skills around supporting somebody through a disclosure, whether that is the professional that has messaged in, it could be a family member, it could be a member of the community, it could be a local counsellor that will come into us. And even that point of contact needs a certain amount of support. It's a big thing to pick up the phone and ring a social worker. People really, really struggle with that. And we're there to support them. We let them know that it is a confidential service. And believe it or not, some people don't realise it's a free service, and it very much is. And people will ask you how much it's going to cost. And that nearly is upsetting for me, because I hate that when people would think they'd have to pay for this service. So it's about getting the message across that, you know, we're there for you. Okay, there's limits to our confidentiality, but in general, you know, unless somebody is at harm or about to harm somebody else, we're there to support them and walk with them along their journey of protection. So I suppose when the referral comes in, then we're screening it first of all to make sure that it is an allegation of abuse. Sometimes people just need signposting. They need some support. It might be advocacy. It might be, you know, social welfare, and we're pointing them in the right direction, and we'll support them along there. Sometimes they need us to walk them to the door of the service that they need, and sometimes they just need us to give them a phone number, whatever that is. And again, they're the kind of assessing skills that we would have as social workers to determine what level of support they need. And then I suppose moving on to actually how we get engaged, the first thing we do is we speak to the older person. In this case, we're talking about an older person, financial abuse. That is our first port of call for all social workers. And that's what I've noticed the change since social workers have come in, since social workers have this service for, I suppose, elder abuse and then into safeguarding. The difference is now we are led and supported, like, and you use the term, Derval, you know, rights holders, and it's the same for us in safeguarding. We're going out to the older person first, and that's even been surprising for other professionals who say, well, why would you go to them first? Why wouldn't you go to their daughter? She's the next of kin. So we educate people even when we're taking in the referrals, which is interesting. So we start with the older person, and I tend to see them as my boss in that type of the assessment. And we need to be able to recognise when people can't protect themselves and need a higher level of support, and even where decision making is an issue for them. But we're starting, it doesn't matter about capacity, we're starting with the older person in or the person with disabilities. They're our first port of call.
But thanks very much, Geraldine. Thanks to you for explaining the work, the role, and how you put the person first. Just one final, very quick question, Geraldine, has just come in on the,
I see something
panel
popped up.
discussion here around in the Southeast. how many would be reports that would come via services, i.e. designated officer, and how many come in from the general public through referrals? What would be the breakdown in your area?
Yeah, so it's interesting, and for me, this for me is one of the we can all bash the HSE at different times, but this is one where I just think the HSE has done a very, very good job, along with the designated officers in the different services, is the reporting ratio from designated officers. It's probably about 60-40 and can even be 70-30, 70%, 30%.
Same national, yeah.
Absolutely. And that's not because there's more abuse. It's they are so on the ball. They are looking at it. They're assessing it. We will get referrals in. A lot of the times there will be no grounds. Sometimes there'll be reasonable grounds. But when you get a preliminary screening in, you get what has happened, the steps they took to take it, and an interim plan that they put in place to protect them. So definitely, I can see that the reporting rate is much higher when there's a designated officer in place than when there's not. And that is because they know what they're doing, and they've got the training and the knowledge that they need to spot abuse, respond to it, and manage it appropriately.
Thanks very much, Geraldine, and I thanks very much for the question there. I've got a very interesting question. I'm going to go to Sarah and Dervla on this one, and it's coming back at the kind of macro level, the policy and the legislative level, and the need for change. And it's around the question of mandatory reporting. As people might know on the call, the Law Reform Commission are currently looking at a regulatory basis for adult safeguarding. The Department of Health have their review and will be making a submission to the Cabinet, hopefully early next year. There's a strong debate about, the carrot and stick. We talked a lot about encouragement, empowerment, supporting people, educating people. We know from child protection there are sanctions for non-reporting for certain professionals in certain roles. And I have a question in around mandatory reporting, and in terms of, is that the road to go, or should it be more permissive reporting for in certain contexts or certain designated type people? Hard enough question, Sarah. I might come to you first.
Yeah, no,
because I know it's a huge debate about whether there should be some mandatory legal requirement there, and obviously with that may come sanctions. What would your perspective be on that?
Absolutely, and it's, as you say, it's a difficult one, and it's something that's been discussed at length for many years. And obviously, when it comes to children, it's quite straightforward, but when it comes to adults, it's not. And one of the things that kind of complicates it is often, the will and preference of the person themselves. As an adult, whether they would want
autonomy and all of that. Yeah.
Exactly, and so that's something that complicates it. So if you've got a situation where you feel that somebody is being or is experiencing abuse, but they refuse to allow you or tell you that they don't want it reported, that actually, I suppose that's one of the complicating factors of it, and then whether the person has the capacity or whether they're being coerced as well. So I think there's more to be done around kind of legislation as well, particularly around coercive control and those things that we already have in place, until we can kind of get to a sort of a satisfactory answer on mandatory reporting. In some countries where it's been operating, I know that people get very bogged down in administration and red tape around it, rather than actually providing the support that the person needs. So it's a difficult balance to strike, I think, when it comes to adult safeguarding.
And Dervla, from your point, obviously you work in an organisation, representative organisation, where the rights and interests of people are central. Have you a view on that? Because I know it's a huge debate within the safeguarding community around should there be mandatory reporting or not, or if could there be some form of it, or should it be form of permissive reporting?
Yeah, similar to what Sarah's saying, I just think there needs to be more in-depth conversation about it, and it is complex when it comes to upholding people's rights. Yeah, and there probably is a space to look at in certain situations or within service provision, that there should be mandatory reporting. But I do think there needs to be a whole lot more debate about it, discussion about it, thought about it. And hopefully next year we're going to really put safeguarding on the map in terms of what's happening at a government level. What we do know is that legislation needs to be in place urgently, and there needs to be backup to this. So yeah.
Yeah, thanks very much, Dervla. One of the things that came up, and I see one of the questions here, and it came up during our review of our own policy, and I know it's very topical with the Department of Health, is the idea of thresholds, and I know in the United Kingdom and other areas that and it kind of follows I suppose, on from the mandatory. Certain lower level abuse wouldn't be mandated to report it or required to report it. Don't know if Geraldine, would you have any view on that? That you know, again, it's a very live topic. The idea of reporting thresholds. There'd be a level at which the abuse, in terms of intent or severity or impact, you know, that below which it wouldn't be reported. I don't know if you have any perspective on that. So questions come in around that.
Yeah, I think it's actually a really, really good question. And when I saw it coming up, I was immediately struck that we have a situation here at the moment where, you know, particular person who is funded through disability services in a residential facility in the north, and the struggle with the funder being here in the south and seeing how they do things different in the north. So peer-on-peer abuse would be sent in a preliminary screening here to the safeguarding team in the north. That wouldn't meet the threshold, and even low level of abuse wouldn't. So I was really struck, and I started to read a bit about it. And I suppose another particular assessment that we're looking at the moment is a particular one in Durham, again, where they look at low level of abuse. But it's not that it's ignored. There still is procedure and a policy around that. So, you know, this particular one we're looking at had 5 levels, and 2 of them were seen as low level, and the 3 met the criteria for, I suppose, what we'd call a preliminary screening here in the south of Ireland. So I found it really, really interesting, and I feel like as social workers, that's what we do already. So we will often get a preliminary screening in or a referral in, and we can see it's very low level. Once off, there's no particular harm as such, or it's something that we really we need to maybe monitor and keep an eye on. So we'll respond like that. We'll be writing up our plans based on that. But I do agree that, you know, sometimes the level of writing up and plans that have to come in on something that's very low level can, you know, I'm not sure how beneficial it is at times, but saying that, we have come from a place where we had nothing. We had no safeguarding policy. We had to do something, and we had to put in the zero tolerance was really, really important. But I think as we mature as a society and we get the message out of safeguarding, and we get used to having policies, and we have a language of safeguarding at the tip of our tongues, we'll have educated people. So we had to start there, and I hope we will move, like Sarah is saying, you know, learning and guidance and moving on to a point where we can understand and manage low levels of abuse without making them a huge safeguarding issue and putting a tag of safeguarding on it.
Yeah, and I hear what you're saying about
abuse,
maybe a
but
less
you know,
compliance-driven approach to
yes,
that whole journey that we've
support
gone in the UK with
yeah.
making safeguarding personal, and always the outcome that the person themselves would choose. Devil, I have a question here that's come in. It's a very interesting one. It's the whole area of online abuse, particularly adults it can happen for any adults, but particularly adults with intellectual disability have been quite exposed in a number of situations with online abuse, and we've seen trends, not just ourselves in safeguarding, to the safeguarding teams. We know this through talking to other organisations, domestic violence organisations, on Garda Síochána, that abuse and exploitation can come off the street, the family home, can go online. Is there any from the work you've done and representing people with disabilities, that any messages you'd like to say about the phenomenon of online abuse and people being, and we've also had the concept, I believe, of entrapment, where people are entrapped and we've also had the concept of mate crime, where people believe people are their friends and they share, and they have been abused by their finances, and they allow people into their trust. Is there anything you'd like to say, or any your organisation have come across around that?
Yeah, I mean, it's an issue for society at large, you know, online abuse, and I suppose it has had devastating consequences for people across the country. Again, I think a lot comes back to empowering people and supporting people's capacity to protect themselves and to know the risks in terms of engaging online and what can potentially happen. And I suppose it's the same premises we have for everybody else in the country. It's about supporting our ability to manage that, to know when to engage, how to protect yourself, how to block potential people, how to when to engage and when not to engage. So I think there's a lot to be done around capacity building and supporting people to manage themselves in engaging online. And that's something at Inclusion Ireland we do all the time in terms of supporting self-advocates to protect themselves. But that shouldn't stop people from having the same rights as everybody else, being able to be online. There's a lot of really positives from that. And I suppose we found during the pandemic that, you know, in terms of the digital piece, how important it was for people with disabilities to be able to access the internet, call people, stay in touch with people, stay in contact, and to avoid loneliness and isolation. So like with everything, there are risks, and I suppose it's just about supporting people to manage those risks and to empower themselves to manage.
So you say the social media and the internet is a huge beneficial tool, but also has to be used right and correctly, and people can be exposed there. Don't know, Geraldine, I know one of the things that has happened during the lockdown was a lot of the scams, and we know from talking to yourselves and the safeguarding team and to the Gardaí, is that still a growing problem with older people being exposed to scams? How much is that happening? Phone scams, online scams?
And interestingly enough, I don't feel that we would probably hear enough about it. I think sometimes it happens. For some people, the money is gone, or they will deal with their bank. And again, days like this and the Assisted Decision Making Act coming in, and working with solicitors, working with the financial institutions, so that when somebody does experience an abuse or a scam, that they would let the HSE know. And again, by building statistics, by building trends and understanding of what's going on and how our older people and a general public are affected by the scams, definitely I have seen the difference in that your average everyday Joe person on the street, whoever they are, is definitely being affected by scams. So I can see that people are more aware of it. But we would have had a time where it was elderly people who were sitting at home, were targeted at the door. And I suppose, now, as you said, they've been targeted on their phone. A lot of older people are using banking online, which is fantastic. And it is a protective measure. They can check their money. They can make sure that there's nothing untoward going on their account. But unfortunately, then they will get text messages which say, click the link. I've nearly been caught with them myself a number of times. So it is a really, really difficult space. And it's definitely days like this, information campaigns, leaflets into the door, letting people know that unfortunately these things do happen, because it's hard to believe that anybody has even got the technology to do what they can do, what they do. And their technology is nearly better than what the banks and that have to protect themselves, which is a really difficult, it's a constant fight. So education, I think, for everybody on how to spot and manage a scam if it does happen to you.
So you're similar to what Deborah was saying, is that technology is a wonderful tool and we shouldn't scare people away from using it. It's really important, particularly during lockdown and COVID times. However, be educated, be careful, and know what you're clicking on. I'm going to come on to the question about coercive control, but first I have a message in from Safeguarding Ireland via Pascal Moynihan, and just to say to ourselves here and Inclusion Ireland and Sage, that just a thank you for having this discussion. Safeguarding said the panel is really discussing the need for society to change its attitudes towards people with needs and to let people make decisions for themselves. All very true, important. Law and legislations can and does shape values and attitudes, and therefore it's important to introduce adult safeguarding legislation, which will not only help protect adults at risk, but also shape society's values and promote respect and independence. Now, an interesting point there from Pascal and Safeguarding that and I think you touched on that, Sarah, around which both need to happen, the societal shifts, and I know Derval, you spoke about that, or even our use of language and our assumptions and our ageist language sometimes, and the models then that go with that, the models, but the law, having it there is so important, that whole sense of citizenship and rights of people and rights informed care. Kind of leads me on to the area of questions come in about coercive control and what has since it became a criminal conviction, what has that meant, and is it enough in the area of adults at risk of abuse, in a non-intimate personal relationship? There are certain restrictions in the law, but has it made a difference? I don't know, Sarah, would you, from your work, do you think that the criminalisation of that coercive control has made a difference?
It's an important message because it recognises, I suppose, that these relationships can be subtle. They can take over time. They can take a big effect on somebody. But I think it's clear it doesn't go far enough. I mean, an awful lot of the issues that we would see in sage advocacy would involve family members who are not, spouses or intimate partners, and they may be sisters. They may also be the children of the person, the older person. So I think it probably doesn't go far enough, or recognize that there can be other long-term relationships where that relationship of trust, dependency, or intimate for other reasons can create the environment for coercion to exist. And it's so subtle, it's so insidious, and it can be so damaging. And similar to what we were talking about earlier around mandatory reporting, it can just lead to a relationship of dependency where you don't want to recognize that you're being abused, or you can't recognize you're being abused.
Geraldine or Derville, do you want to make any comment about that difficulty and how subtle coercion can be? And then in terms of the law currently is restricted, it is a progression that we've had the change in the criminal law. Don't know if, Geraldine, you want to say anything about how subtle coercive control can be. We know the long-term impact of psychological abuse. I know from my own practice many years ago, talking to people 30, 40 years later who had been survivors of childhood abuse, they remembered the psychological abuse. That stayed with them, but often they recovered from some of the physical and other forms of abuse. Do you want to say something about that and how hard it sometimes is to even assess it and to name it?
Yeah, and I think that's the point. I mean, Sarah mentioned about it just being so insidious and so ingrained, and it's just become the norm. And we will often get referrals in from a family member who speaks about, another family member having, coercively controlling their adult parent. And when we go out to them, like, that adult has no understanding, or like, it's how they've always been for the last 10 years. They've been kept back and isolated from other people, and they will absolutely make a very clear choice that that's what they want. And it's so hard to separate what is control and what is actually what they want to do. And this is their new life now. So that particular family member that they have, I suppose, been isolated with is now their world, and that's who means everything to them. So you're listening to will and preference, but you don't know how much of that was based on a coercive control. So, and I'm glad you pointed it out as well, Tim, in that, I suppose the legislation unfortunately hasn't gone far enough at all. And I suppose where we would see as a team more likely, in terms of maybe an older person in the community, it's a nephew, it's a grandson, it's a neighbor, it's a friend, it's a sister, rather than an intimate partner around the coercive control. And as you know, the legislation is really they have to be an intimate partner for it to apply. So that is something I know Safeguarding Ireland has raised, and I think it's probably more of an oversight in the legislation, and I hope that will change. And since that legislation has come in, in terms of when I'm meeting the team in supervision, it will come up time and time again now, that it's a pity the legislation doesn't cover this concern that I have here now for these individuals. So yeah, we're moving there. As I said, we're growing as a society, but we have a long way to go.
Okay, thanks, Jerry. Right, we've got 1 minute left, or 2 minutes left. I'm going to go around to all 3 members of the panel and ask you for one takeaway message or one wish you'd like. If either a message from today. Today is Ireland's first Adult Safeguarding Day, and well done to Safeguarding Ireland taking the initiative, and all the organisations, the services, the professional bodies that have had events today. But if there was one wish or one takeaway message you would want? I'll start with you, Derval. Is there one wish or takeaway message you would want for Adult Safeguarding Day?
Well, I hope you don't mind that I'm actually taking a quote directly from one of the videos, and it's a colleague of mine, Paul Alford, who said it beautifully in one of the safeguarding videos, that it's not support, it is support we need and not pity. And I think that really sums it up for me, that people need support to protect themselves. They need support to be empowered. And that's what safeguarding is all about. And that's the message I'd like to put out
really
there.
Powerful message. Thanks, Derval. And Sarah, if you'd one takeaway message or wish for Adult Safeguarding Day, what would it be?
Not a million miles away from Derval, but just in terms of people understanding what safeguarding means, it means having your rights safeguarded. And we didn't really touch on it, but the right to make unwise decisions, the right to take risks, and the right to have, I suppose, those decisions vindicated and supported as well.
We certainly see that with the commencement of ADM. We'll probably be having further discussions about people's rights to make decisions that professionals don't agree with, or unwise decisions. And for yourself, Geraldine, what would you like to take a message away from today, or a wish?
Yeah, and it's kind of coming from, I see one of the questions there on the chat is about, human trafficking and modern slavery coming in. And I know under the revised policy that will come in under it. And even now, if somebody, we would deal with situations like that. It's quite new to us, and we would definitely need some more training. But I suppose it shows up the whole point of the people who fall through the net, who currently now should be getting, I suppose, a preliminary screening of a preliminary screening of abuse, either by us in the team or a designated officer, and they're not getting it because they don't meet the criteria. I want that to change really, really quickly. I think that is a bit of an issue, and I would like to see the service opening up to all, I suppose, adults at risk of abuse who may need a preliminary screening. And it may not, as I said, it may not be from us, it could be from another agency, but I do feel that for me is I hope that we move on from that sooner rather than later.
Thanks very much, Geraldine. So really powerful messages there around the need to support, the need to empower, the need to respect people's rights, even if we disagree with people's choices, and also how services need to improve and come up. HSE, other organisations are doing that need to improve. Can I take this opportunity to thank Sarah, Derval and Geraldine for coming on this, to Inclusion Ireland and SAGE for partnering with us today. I know it's been a really important day. Hopefully this will not just be an annual day, but will be a platform to promote the adult safeguarding message. We have World Elder Abuse Day in June. But I think it's really important, and I compliment and I really say well done to Safeguarding Ireland to taking this initiative. And from us in the HSE and National Safeguard, we're always open to learning, looking at what can work better, looking at new ways of working, how we can promote the message and improve the message. So can I thank everyone who logged in? Sorry if I didn't get to every single question. We will keep note of the questions. If some I may have to follow back up with, but apologies, we just ran out of time on one or two questions. The recording will be up on our website. We will send a link out, and hopefully, hopefully with Derval and with Sarah there in both SAGE and Inclusion Ireland, and maybe with yourselves down there in the southeast. I know you have a Twitter page as well, Geraldine. So well done, and keep promoting the rest of the day, and have a nice weekend. Take care, everybody, and thanks everyone for logging on today. Goodbye now. Take care.
Thank you. Bye.
Thank
Bye
you.
now. Bye.
Thank you.